enamel contouring, whenever we're talking about that, it is usually a quick fix. A lot of times we don't have to numb somebody, but the enamel chipped for a reason, and we have to find that underlying reason. So once we find that reason and we can determine that, it's a very quick fix for us to recontour those teeth in order for us to make sure that it looks like your real tooth. So it looks nice, smooth, and round, and that you're able to continue to function on it without continuously chipping on it. So the first thing is we evaluate the diagnosis and whatever caused this, and then from there we determine what's the best form of treatment, which a lot of times we can do very minimally invasive procedure, which is to recontour that tooth. So when it comes to enamel contouring, it's a lot more minimally, I'm sorry. When it comes to enamel contouring, it's a lot more minimally invasive compared to a procedure like a veneer. Now, what a veneer is going to do is it's going to restore some of the enamel, and it's going to look like you have some of the enamel restored by adding some more tooth structure. However, before doing that, you have to take away quite a bit of tooth structure just to get that veneer on, about 0.5 millimeters to about a millimeter. When it comes to enamel recontouring, oftentimes we'll do that after we do Invisalign or braces when the teeth were in an improper position. Now we put them in a proper position, and now we can reshape it to make it look like those teeth have never been fractured, cracked, or broken. And so oftentimes we do it at the very end of the treatment where the bite is restored and the force that caused the original chipping is no longer there. So that is a skill set. That's an eyeball. What we do is we look at it and we compare that to the adjacent teeth. Knowing tooth anatomy is very important when it comes to something like this. Is you have to be able to look at the tooth, the smile, and how it fits in the overall face. And so you don't want to do enamel contouring on just anybody. That's why an evaluation is extremely important, because you can make a tooth look smaller than another, and then you can't restore that unless you're going to do a veneer or maybe some composite bonding. So evaluation, and then also setting the patient expectations ahead of time, that's going to be extremely important in order for us to determine whether if you're a fit for that at all. So a lot of times patients will seek enamel contouring is during their exams, they'll just notice that there's some chipping on their tooth, or when they take a picture, they notice that there's a chip in their smile, or they prefer to smile on one end versus another end. And so that patient will bring up that concern to me, and often it's too small to put a filling on there because it can just break off. And so the procedure and the treatment would be, hey, how about let's reshape some of these teeth in order for us to make it look like these teeth had never had a chip in it. And so it's usually the patient that points it out to me because it bothers them for one reason or another. So after having the enamel contouring, of course, we want you to come to your dental office and come to your dental visits in order for us to ensure that everything else is working well. But the main thing is what caused the chipping in the first place. So if it was your bite, you don't get your bite corrected, again, it can lead to chipping and wearing again. If you have sleep apnea that produces a different type of pattern on your teeth, that would cause continuous recontouring. So the sleep apnea would need to be under control. If it was your bite, then Invisalign or braces would be the way to fix it permanently. So again, it comes down to let's find what the cause is, and then we can determine how to save this long term for you. So the enamel contouring can be combined with other procedures, like for example, Invisalign. Oftentimes at the very end of our Invisalign treatment, we'll contour the enamel in order for us to shape that. If we're doing whitening, we want to contour before we make the whitening trays. And if we're doing bonding, we want to contour before we do the bonding in order for us to match the bonding to the enamel contour. And so what does that look like? If we're reshaping the teeth and we're trying to match the adjacent tooth and we need, let's say, more enamel on this side, you're looking for at least 2 millimeters of enamel that you want to restore. That's the clinical criteria to do some filling material. If it's less than that, you typically do enamel recontouring. So it depends on how big the chip is. And so we want to match those as much as possible and make it look as natural as possible. And if we look at those clinical criteria, then we can combine said procedures in order for us to match it as closely as possible. Well, a lot of times after the enamel procedures complete, most patients, they love it. They've been taught, some of the dentists kind of feel uncomfortable doing something like this. We've been doing this for years. And so a lot of patients were like, finally, that chip is gone, or they just smile more in their pictures because there's not much maintenance after that. You just come to your office, you brush, you floss, and you clean. And it's a very simple procedure. There's no sensitivity, no pain afterwards, which is great. But other than that, there's really not a whole lot that they complain about. So the very first step that somebody should do to get in touch with us is either make an appointment online or give us a call. Our front desk is ready for anybody to call and set you up with an appointment. You just let them know that you're interested in enamel contouring. Of course, we'll do the comprehensive exam where we take a look at everything, but we'll hone in on your main chief complaint. If that's your main complaint, we'll figure out what caused that and then how to fix that. And then we'll go over pricing and go over some of the treatment that's required for that. Oftentimes we can do that same day. So if you'd like, and if you have a wedding coming up or you have some pictures coming up, and you can come in, make an appointment, and oftentimes we can get you taken care of same day. So